Dr. Alex Samuel, Health Director of the Chesterfield Health District, which serves the residents of Chesterfield County, Powhatan County, and the city of Colonial Heights. I wanted to talk about the rising case numbers we're seeing in the district, largely attributable to the Delta variant of the COVID virus. Some of the tools at our disposal to protect ourselves and work to reduce the spread of the virus. One of the ways public health officials try to understand and measure the presence of an infectious disease in a community is through the concept of community transmission. For COVID-19, the CDC uses two measurements to describe the amount of virus in a community. The first is the total number of COVID-19 cases per 100,000 within the past 7 days. The second is the percentage of PCR tests that were positive during the last 7 days. PCR is a type of COVID test that has a high degree of accuracy. We saw case numbers sharply increase during the month of July. By the end, Chesterfield County crossed the threshold value of more than 99 new COVID-19 cases per 100,000 persons for a 7-day period, officially designating our locality as having a high level of community transmission. Most localities in the Commonwealth now have high levels of community transmission. Nearly 11% of all PCR tests being conducted in our health district are coming back positive for COVID-19. Beyond this, case numbers have been climbing at a rapid clip, mirroring trends we saw last winter when the rate of increase was at its highest. Unfortunately, the risk of contracting COVID hasn't gone away, especially for those who weren't vaccinated. The new Delta variant is believed to be fueling this latest wave of COVID-19 cases, with estimates close to 98% of new cases attributable to Delta. There's good data that shows that Delta is more than twice as contagious as other variant strains, and there's some evidence showing that it may cause more severe illness in persons who are unvaccinated compared to other strains as well. Delta adds another twist to this COVID story in that some fully vaccinated people have contracted this new version of the virus and been able to transmit it to others. Vaccinated people who become sick with COVID typically have mild flu-like symptoms. The vaccines are working as they should, in that there are very low numbers of serious outcomes associated with Delta infection among the vaccinated, like hospitalizations and death. Among the nearly 5 million Virginians who had been fully vaccinated through August 14th, less than 0.2% had developed COVID-19 infection. 0.009% were hospitalized, and less than 0.002% died. Vaccinations are the best way out of this pandemic. Until more eligible people get vaccinated, the best way to protect yourself and your family is to wear a mask indoors in public settings in areas of substantial or high transmission, regardless of your vaccination status. And as a reminder, on August 12th, the State Health Commissioner issued a public health order requiring all students, teachers, staff, and visitors in K-12 schools aged 2 years and older to wear masks indoors, regardless of their vaccination status. The science behind the benefits of wearing a mask has been evolving as more studies have been conducted. There's growing evidence that cloth masks and surgical masks significantly reduce the risk of contracting COVID-19, especially in settings where everyone is wearing a mask. The virus is primarily spread when those who are infected cough or exhale droplets or particles that are then inhaled by those who are not infected. Masks work by blocking the amount of virus that is spread right at the source. They also work by preventing those who aren't sick from inhaling droplets and particles by filtration. The combination of source control and filtration has been estimated to reduce the risk of transmission by 70% in certain studies. Thus, mask use by everyone in an indoor public setting makes sense where there are high rates of community transmission. Combining masking with social distancing reduces this risk even more. It's important to remember that up to 50% of COVID transmission has been attributed to people who have no symptoms of COVID, which is another reason why universal indoor masking in public settings is recommended. I want to conclude by reminding everyone that vaccines are still the best way to protect yourself and those you love. Information about where you can get your free COVID-19 vaccine can be found at vaccinate.virginia.gov or by calling 1-877-VAX-IN-VA or 1-877-829-4682. Thank you and have a great day.